Hey everybody, this is Dr. Langdon, board certified pediatrician, mom of 6 and grandmother to 3, with a reaction video today. I don't know if you've heard it, but this week Dr. Oz, who by training is a cardiothoracic surgeon, came out with the statement, a conversation that we pediatricians are, I'm not making this up, he said, grooming teenagers when we ask for their parents to step out of the room during a routine adolescent well-child check. First of all, it's a little frustrating because you don't see me trying to teach Dr. Oz how to do cardiothoracic surgery. Could everybody please just stay in their lane? And I'm also obviously now convinced that he understands nothing about adolescent well care, including confidentiality. Maybe he doesn't remember being a teenager. Maybe he didn't have teen children. Maybe he's never met a teenager. I don't know. But teens often are nervous, shy, embarrassed, afraid to share intimate information in front of their parents. Also, if you think about it, one of the main things we want to assess when we have them alone is, do you feel safe at home? Well, if they don't feel safe at home, they're not going to say so in front of the parent because it could potentially be that parent who's the abuser. I'm not saying that we think all parents are abusers, absolutely not. But we cover a lot of ground in those very few short minutes we have with them alone. Some things we want to check on are, what's their mental status? We'll try to review their depression screening during that time. And I can't tell you in these 30 plus years of pediatrics how many times I will reveal that a patient has had a prior suicide attempt and the parents don't even know. Now, if they're in no immediate danger, I'm not allowed to breach their confidentiality and share that earth-shattering news with the parents, but sometimes the teen wants me to help them tell the parent. Maybe they've been asking for counseling or medication or whatever, and the parent doesn't realize how serious this is. And so then I'll help the teen share that information when we have the parent to come back in the room. Similarly, we ask about their menstrual cycle. I've had dads, when I was seeing a teenage girl, who couldn't get out of the room fast enough. So not all parents complain about being asked to step out. Understand that as well. But maybe we're asking them about if they've become sexually active and if they're practicing safe sex, how many partners. We're assessing for safety and risk and infections and things like that. We are absolutely not the ones there telling them to become active. That's nuts, guys. We wouldn't do that. We're assessing for safety. Do you wear your seatbelt every time you drive? Are you texting when you drive? We're assessing for substance use. Are you smoking anything? Are you vaping? Are you using marijuana? Are you using any street drugs? Are you feeling peer pressure at school? Are you being bullied? Things that the teen may not feel comfortable discussing in front of the parents. We need to know to take better care of them. So not only are we not grooming, we are there to encourage and inspire good decision-making in the teen years, which can be very challenging. So just know that we pediatricians, we're already pretty burned out on all the things that are happening right now. But this further attack on us from a surgeon, no less, you can be a pediatrician for some years, buddy. Make our salary, care about these young people as much as we do. And maybe then you could start to understand the nuances around adolescent confidentiality. Thanks.